Hello and welcome to the second video about diabetes talk. Today's video is going to be on the basics of diabetes and just really what it's all about and the two types of diabetes, how it's diagnosed and things. We're mainly going to be talking about type 1 because I don't have a clue about type 2 diabetes. But yeah, type 1 diabetes is also known as insulin-dependent diabetes. A lot of people just ask whether you have the diabetes where you inject yourself or take tablets. Type 1 is where you inject yourself with insulin, and type 2 is where you take tablets to control your blood sugars. So yes, usually to diagnose diabetes, people would have shown symptoms like feeling very thirsty, going to the toilet quite a lot, feeling very tired, and weight loss in type 1 because you're not absorbing the insulin, so your body starts to use your muscle and fat as an energy source. So you lose lots of weight and it's not a pretty sight. For type 1, the main theory about the cause of it is that your body's immune system that would usually try and stop colds or illnesses mistakes your pancreas cells to be bad things, so attacks them, so they can't produce the insulin that we need. As I said, type 1 is treated with insulin. There are many types of insulin, and I've been around and a lot of people have said that they wouldn't be able to inject themselves if they were diagnosed, but it's not a case of having a choice. You have to do it or you will end up dying or getting very, very ill. Before I got my pump, which I will talk about in a later video, I had to do at least 5 injections a day, and a lot of people would ask whether it hurt, and it really doesn't, because the needle's mine were half a centimetre big, and they're incredibly thin and you can't feel a thing really. A lot of people also make the mistake that diabetic people are always on the overweight side, but that's not the case at all, because it all depends on diet, just as it does with anybody else, and for instance, whether you're controlling your diabetes very well. There was a time where my blood sugars were all over the place, and I had dropped down to 6 stone from around 8.5 stone within a matter of a month or 2. It was terrible, and I will also go into detail in that in a different video. Skim over some of the things that can happen if you go undiagnosed for too long. You can get eye problems because of the sugar in your blood. Your vision can get worse, and in extreme cases it can cause blindness. It can also damage all the organs in your body again, because it's to do with the blood system, and blood's everywhere in your body, isn't it? Yeah, as I've said, people have said they wouldn't inject themselves, but it's a case of getting used to it really as well, and living with it is fairly easy when you get the hang of it. A lot of people choose to ignore that they have it at some point because they don't want it anymore, and it's really not good for you to do that. You kind of have to just get on with it. The way you live, even without diabetes, can affect how you look and things, but some of the normally unhealthy things can become twice as dangerous with diabetes. For instance, smoking can be quite bad for you, as diabetes brings with it a risk of cardiovascular disease, as does smoking in general, so it's kind of upped your chances there. Alcohol is also quite bad for diabetes, but they're not saying don't drink it at all, but drink less. I mean, it's not good to drink a lot anyway, but you have to drink quite a bit less with diabetes. That's the end of today's video, just the basics really. I'll probably go through hypoglycemia in the next video, which is low blood sugars, and I bid you all a nice day. Goodbye.